Hi, I'm Dr. Tay Chee Geap. I am Consultant Pediatric Neurologist at Sunway Medical Center. When we are talking about children with global developmental delay, we are talking about children who are less than 5 years old. Children with global developmental delay, they are usually experiencing significant delay in the developmental milestone. What are the area of development milestone? There are 4 areas. The first area will be a motor skill. The second area will be a social skill. The third area will be the speech or language. The final one is cognitive functions. In Malaysia, we do not have exact data regarding the prevalence or incidence of global developmental delay in children. However, in other countries, there are studies done and show that 1 to 3% of the children population are affected by global developmental delay. In terms of the causes of the global developmental delay, so they are heterogeneous, meaning that there are many causes. Okay, it can be categorized in the few categories. The first one will be genetic related, meaning that neurogenetic disorder, inherited disorder. Okay, the second category can be pregnancy or birth related. So it means that it can have an injury during the process of the pregnancy or during the delivery process. The third category usually due to environmental exposure, for example, exposed to infections, etc. So we need to know whether what is the underlying cause for the global developmental delay. If the cause is due to underlying genetic disorder, then it is most likely a permanent disorder. Alright? If it is due to social deprivation, lack of stimulation, then it is likely to improve when we actually provide adequate stimulation to the children or the populations. The easiest way I would suggest is actually to compare with the peer. When I talk about peer, it's actually seeing their own cousins, the similar age group, can also compare within the childcare center, in the kindergarten school, also can get the feedback from the teacher whether they attain the similar level or similar skills as compared to others. If there is a significant delay, so probably you need to look for medical or seek for medical advice. When we talk about treatment for global developmental delay, we have to identify what is the underlying cause. If the underlying cause is due to underlying genetic disorder, unfortunately, there is no definite cause for the global developmental delay. However, we can provide supportive care, we can provide therapy, hope that they can improve some of the functions, some of the motor skills, for example, speech therapy, rehabilitation, physiotherapy, occupational therapy that will improve some of the function skill. Those people who are affected by because of the deprivation, social deprivation, then we probably have to provide adequate care, provide adequate stimulations, then very likely they will improve and they'll catch up with the peers. If the parents are very concerned about the children's development milestones, my suggestion is not to ignore them. You have to bring for further medical assessment.